My name is Dr. Priyank Solanki. I'm an eye surgeon. In today's video, I'll be discussing with you about something called as myopia. Now, what is myopia? Myopia is a condition of the eye where your vision becomes blurry for distance. For near, anyhow, you can see clearly, but for distance, it becomes clear. So these kinds of conditions is called as nearsightedness or short-sightedness. Means you can see the near one, but the distance becomes difficult. Myopia is very commonly seen in children. Now, at what age? It can vary from as low as 2 years to an adult of 50 years. So, in today's video, I'll be talking to you about special conditions of myopia in children. Now, why do we see these cases of myopia increasing more in today's days children? There are quite some factors which we have seen and identified recent researches which has been done. One of the causes is that one of the parent or both the parent might be wearing glasses and they also have myopia. Second, the physical activity of the child is lesser. Third, the optical activity means your digital devices. So I'll be covering each and every point one by one. Now, so before we start on with these conditions, the causes, I would want to give you first a small introduction and brief or data what a myopia is there in today's day life. So a recent publication which has been done also which has been noted by WHO says that by the year 2050, that's 2050, about 50% of the population in children will be myopic. In other words, 50% of children will be wearing glasses. Now that's a very high number. In other words, 1 in 2 will be wearing glasses. Now this prevalence will be increasing over time. So now we need to understand what are the causes for it, how we can control it, and if there is a method to treat. So I will be going in brief about each of them. So first, coming on to the causes. One of the causes for this is the strongest factor, genetic factor. Now, if one of your parents or both of your parents are wearing glasses and have a specific condition called as myopia, then there is a high chance that the child can also have a myopia. Now, it is said that about if the one parent is wearing glasses of myopia, then there is a 30 to 50% chance that the child can also have the similar condition. But if both the parents have the same condition of myopia, then the child can have around 70% chances that the child may get a myopic condition. It may not be that if the parent has the same power, the child will have a similar power. No, it may be lower, but more of the conditions, majority of the times, it may be higher power also. Let's say, for example, if the parent has around -2 or -3, the child can show that the power can go up to -6 or -7 also. So it is not a rule that this is always higher, but this is a general condition that we see. The second cause is the environmental factors. Now, we have seen that more the indoor activity, less outdoor activity has a higher prevalence of myopic conditions. So if your child does not have more outdoor activity time, okay, like playing games, cycling, swimming, any other sports, then that might cause the prevalence of myopia being higher. It is said that about 1 to 2 hours a day, a child should be exposed to the natural environment outside the house. Recent researchers have also shown that a specific molecule called as dopamine, this becomes more when you're exposed to yourself to outside, specifically sun, and this might have a small factor on your control for the glasses or control for the myopia progression. The third one is the optical devices. Now we need to understand that this is one of the strongest factors nowadays that we see. Most of them are on digital devices. When I mean digital devices, these are mobiles, tablets, smartphones, televisions and laptops. Most of the work now which the school gives is either on laptops or on digital devices like iPad or tablets or smartphones. Now, more time spent on this has a stronger preponderance for progression of myopia. We see that on an average, if you scale up to 2 hours of a day of a screen time, that has a higher percentage of increasing the myopia power. So now how do we control this? So what happens is you need to understand that if you control your causes, then the effect can be controlled also. So genetics is something that neither of us can control. It is by nature, which goes by vertical transmission. So that's one of the causes. Second one is the environment, which is outdoor activities. Yes, a child should be having his physical activity daily about 1 to 2 hours outside. Third thing is the optical, which I said. Now, this has to minimize as much as possible. Let the child do more of non-near work. When I mean near work, use your book studies also. A child going much closer for reading has more chances of progression of glasses. So you need to control this. So after every 15-20 minutes, let him take a break of 2 minutes, focus on distant subject. So the muscles will relax and he might have a better vision also. Whatever he's reading should be under a good bright light. Do not keep the area a bit dim. It should be natural light is better than a LED light. The third thing is the font size. The font size of the digital screen should not be smaller. Keep it a bit larger at around 12 or 14. That is the standard better font size for your reading. The other thing is do not keep the screen brightness too high or too low. It should be according to the room lighting. So these are the things, these 5 points which you should see that the child can control. So in today's day, we see that more and more of schools are giving homeworks via your smartphones or online. So it is inevitable that you cannot control them, but then you can definitely decrease it. So the former points which I said needs to be followed. So what are the other treatments that we get? So for myopia, glasses are the basic treatments that you get. Now these glasses help you to see clear, but these are not for the control for the progression. These are to see your vision clear. So one of the more common ones which we use is now glasses, which we are. There are new technologies of glasses which have come called as myopia control or myopia regression glasses. Now what happens is in this the glasses design are a bit different. Now for example, let me show you this. There is a company called Essilor which helps you out. They have a different design of lenses. Now these are the lenses, let's say the glasses lens which you are wearing. There are small lenses which are studded or inside the lenses. Now these small lenses are called as lenslets. Now the magic happens here. Now these lenses helps you to focus on the retina in a specific way that the growth of the eyeball, why it happens is a different thing. Now these small lenslets help to focus onto the retina in such a way that the growth of the eyeball is restricted or decreased. So how do you identify that these lenses are here? It's by this, right? Now I'm going to be showing you how these lenses are made. So these lenses, can you see this? Now when you see a lens over here, it seems as if it's a normal lens. There is no change at all. But when I shine a light on this, okay, you'll be able to see that there are so many small circles over there. Now these small foci of the lenses are of the individual lenslets. Now this is the one which helps you to control your progression for the power. Okay, so this is the Stellest myopia control lenses from Essilor. The other one is called as an ortho-k lenses. So what happens is in this the specific type of contact lens is made, and these are to worn when the child is sleeping at night. So when the child sleeps, the lenses are put, and when he gets up in the morning, the lenses are removed. So this helps you to control the curvature of the cornea so that the vision is clearer by the day. But again, by evening, you might have some distortion of vision because the cornea again changes its shape because of its elasticity, and the vision might be blurred. And the third one is the drops called as a pharmacological therapy. Now there are specific drops which are available for this called as the atropine drops, which is 0.01%. Now these are drops which are prescribed by your ophthalmologist and dispensed by your pharmacist. Now these drops are used once at night during your bedtime every day for about 3 months or 6 months, or as prescribed by your doctor based on the condition of your eye. These are known to control the progression of your eye. That means the progression, that is the length of the eye, it can help you out to control the size or the length of the eye. Hence, by this, it helps you to control the power. So when you use these drops, there might be a small changes that the child might say that he's a bit more photophobic, in the sense when he goes out in bright sunlight, he might say that it's too bright, there's some glare. That can happen. Or the child might also say that he's not able to see clearly from near. Now that is because of the effect of the drops. So for this, the doctor can give you additional glasses if required based on the condition of that. So in short, these are the broader treatments that we see. So to summarize this up, I will tell you first again what a myopia is. A myopia is where the condition of the eye is a bit longer and the curve or the curvature of the cornea is longer. Means the curvature of the cornea is a bit more, it's more steeper, or the length of the eye is a bit longer. Majority of times it's the length which is the problem. So the length of the eyeball is more, right? The cornea, which is here, can also be more curved, but then there will be a different kind of power called as astigmatism also. But the major power is because of the length of the eyeball. What are the causes? First, the genetic cause. Second, the environmental, means your outdoor activities. Third is your near work, which includes your reading, writing on smartphones or on notebooks. Third part is the treatment part. In this, again, we have three types. First one is the glasses, regular glasses which most of the opticians or your eye doctor will prescribe, which you can use. But these are to clear the vision only, but not to control your progression. For this, we have specific lenses called as the myopia control lenses, which your doctor will help you to understand more based on the type of power you have. The second type of treatment in this is the contact lenses called as ortho-k lenses, which you can use. And the third one is the drops called as a pharmacological therapy. Okay? So this is what is about a myopia and myopia control therapy. I hope this video was helpful for you to understand about myopia, and if you have any other queries, please write comment and we will help you to answer soon. Thank you.